Welcome to the 7th part of the Sleep and You series, part of the Four Wing Balance Library. This series is presented by the Four Wing Health Promotion Department. This series will be talking about sleep hygiene and how to increase your sleep quantity and better your sleep quality. What is sleep hygiene? When we say sleep hygiene, we mean the variety of different practices and habits that are necessary to have a good nighttime sleep quality and full daytime alertness. During this session, we're going to discuss some strategies that you can use to help have good sleep hygiene. First, have a schedule. Our biological clock likes routine because it follows an approximately 24-hour schedule that controls how our body functions, including our temperature, hormone secretion, including melatonin and cortisol. This is part of the reason why you generally sleep well at night when it's dark outside and feel awake during the day when the sun is out. It's important to go to bed and wake up at the same time every day, plus or minus 30 minutes, including on the weekends. To do this, pick a bedtime and wake time and stick to them as much as possible. If you're new to having a sleep schedule, make gradual changes rather than trying to change your schedule overnight. Avoid stimulants. Stimulants are substances that influence our energy levels and alertness. They do this by affecting our central nervous system. Caffeine has been found to increase our sleep latency, which is the time between when you get into bed and when we fall asleep. It also reduces our total sleep time, sleep efficiency, and perceived sleep quality. Total sleep time is essentially how long we actually sleep during a sleep cycle episode. Sleep efficiency is the proportion of sleep in relation to the total time spent in bed. And our perceived sleep quality is a subjective experience. People who are dependent on caffeine may also experience increased daytime dysfunction and increased nighttime disturbances. Nicotine dependence has been found to be associated with poor sleep quality and increased sleep disturbances. People who are nicotine dependent have also been found to be more likely to rely on sleep medications. When we use stimulants, it can affect the quality of our sleep. For those who are dependent on one or more stimulants, they can experience withdrawal symptoms if they try to quit. One of these withdrawal symptoms can be sleep disturbances. If you use stimulants, try to avoid doing so after the late afternoon. Limit alcohol. Drinking alcohol before bed has been linked to more slow-wave sleep or delta activity. Slow-wave sleep is deep sleep that allows for memory formation and learning. Alcohol consumption also turns on alpha activity, which typically doesn't happen during sleep, but instead while we're resting quietly. Together, delta and alpha activity may inhibit restorative sleep. As a depressant, alcohol may help you fall asleep quicker, but it's common that a person will wake up during the night. Alcohol can affect the normal production of chemicals that trigger sleepiness when you've been awake for a long time and subside when you've had enough sleep. Adenosine is a sleep-inducing chemical in the brain that is increased following alcohol consumption, which allows you to fall asleep quickly. However, this chemical subsides quickly, making you more likely to wake up before you're actually rested. Alcohol also blocks REM sleep, which is often considered to be the most restorative type of sleep. When you don't have enough REM sleep, you're more likely to feel groggy and experiencing difficulty focusing when you awaken. Alcohol causes muscles to relax, including those in your throat. This can make you more prone to snore and can increase difficulties with those who have sleep apnea. Alcohol is also a diuretic, which can make you get up to use the bathroom more often during the night, thereby interrupting your sleep. Feel the light. It is important to expose yourself to bright light in the morning and throughout your waking hours. Sunlight helps the biological clock to reset itself each day. This is very important if you don't get outside much during the day or live in an area where there isn't much sunlight. Try to get outside as often as possible, but at the very least, make sure your curtains are open. A light therapy lamp could be useful for those who have difficulty getting enough natural sunlight. Research has shown that light therapy can be effective for sleep problems in general, specifically insomnia and circadian rhythm disorders. Have a comfy bedroom. Having a comfortable bedroom is important to having a good night's sleep. Make sure that your mattress is comfortable and supporting. Life expectancy of a mattress is between 7 to 10 years, although this can vary based on brand and type. Pillows should be comfortable, suitable for your sleeping position, and supportive. Pillows should be replaced every 1 to 2 years, depending on brand and type. Generally, pillows absorb oil, dead skin cells, and hair, which plays into replacing it so frequently. Wash your pillows every 6 months and add a protecting case between the pillow and pillowcase. Make sure your room is attractive and inviting for sleeping. A messy bedroom can increase discomfort and stress, making it difficult to relax. Your bedroom should also be cool. The optimal temperature varies for people, but is generally between 15.5 to 21 degrees Celsius. Turn off or dim bright lights that could be disruptive. If you are specifically sensitive to light or live in a location where the sun shines in the evening or night, invest in blackout curtains. You may also want to try an eye mask. Try to reduce or remove any disruptive noise sources. This can be done through the use of earplugs or trying a white noise machine or fan. Exercise. There is strong evidence that moderate to vigorous intensity aerobic physical activity improves quality of sleep by reducing the time it takes to fall asleep and the number of awakenings throughout the night. Exercise can also increase the time spent in deep sleep and reduce daytime sleepiness. Although the Canadian Physical Activity Guidelines is that adults aged 18 to 64 need to accumulate 150 minutes of moderate to vigorous intensity aerobic physical activity per week to achieve health benefits, the amount of exercise needed to help improve sleep is 10 minutes. That doesn't mean that you shouldn't accumulate at least 150 minutes. It just means that a little bit of exercise is still better than none. There is evidence that engaging in light intensity physical activity longer than the time recommended in the physical activity guidelines can also be beneficial to sleep. Limit napping. Naps can be good for people who don't have any difficulty falling asleep or staying asleep at night. Otherwise, the time you spend napping may take away from your total sleep time at night. The optimal duration for a nap is about 20 minutes, which is sufficient to feel rested, yet short enough to not interfere with nighttime sleep or your alertness. Steer clear of disruptive foods. When we eat foods that are heavy or rich, fatty or fried, spicy, or have a lot of citrus or carbonation, we may experience acid reflux or indigestion. This can make it difficult to sleep, as lying in a flat prone position generally exacerbates symptoms. Sugar at any time of day can affect sleep quality. If you are truly hungry, have a light snack, which is healthy. Relax before bed. When we engage in a regular nighttime routine that includes relaxing activities, our body is triggered into recognizing that it's time for bed. Avoid emotionally upsetting conversations or activities prior to sleep. Avoid bright light, especially blue light, prior to bedtime. Exposure to blue light in the evening can be disruptive to sleep because it suppresses melatonin production when melatonin is functional and desired, essentially when we want it to aid with our sleep. Blocking blue light emitted from electronic devices has been found to be effective in improving sleep for military populations. Change it up. If it can sometimes be difficult to sleep, instead of tossing or turning, change up your scenery if you're unable to get to sleep within 20 minutes of turning off the lights. Leave the room and engage in relaxing activities such as reading, listening to calming music, and when you're tired, go back to bed. Avoid stimulating activities, bright lights, blue lights, and make sure that any lights are dim. Reserve your bedroom for sleep and intimacy. Keep cell phones, TVs, computers, and video games out of the bedroom. Keep work materials out of the sleeping environment. And this will help to strengthen the association between bed and sleep. Listen to your bed partner. If your bed partner is concerned about your sleep, listen to their concerns. Oftentimes, our bed partners are better at detecting sleep issues than we are. If you have worked on achieving better sleep hygiene and are still experiencing difficulties, you may have a sleep disorder which is making it difficult for you to get enough sleep or good sleep. Speak to a healthcare practitioner if you are still experiencing difficulties. This is the end of this session of the Sleep in You series. Although this is the 7th part of the series, you can go ahead and look at the rest of the series to learn more about sleep.